Welcome today to our joint seminar with IFAM and NUCATS members. I have the privilege today of introducing our speaker, but before that, I just want to share a little housekeeping. We have participation both in person today. If you have questions, raise your hand, just the old-fashioned way. We also have participants through Zoom. If you have questions, we encourage you to post them at any time during the presentation, but please use the Q&A function on your Zoom menu. Don't use the chat function. We'll be monitoring the Q&A and probably open up and address the questions that you post at the end of the presentation. We hope it goes well. If it doesn't, we'll be monitoring the Zoom. Today's presentation is titled Mentoring the Mentors, NUCATS Programming, Assessment, and Outcomes. I'm very excited to announce our speaker, who's my colleague, Dr. Kenzie A, a professor of medicine in the Division of General Internal Medicine here at the Feinberg School of Medicine. Kenzie also holds secondary appointments in our departments of medical education, preventive medicine, and medical social sciences. In addition to being a brilliant communication scientist, qualitative researcher, and has a focus on prevention and a lot of other sort of issues relevant to primary care, which is the area we work in general medicine a lot, as well as many other parts of our campus. Kenzie has a special expertise in mentoring. And as members of the Academy, we really want to offer really strong career development resources to all of our faculty across the entire career continuum. But when we mentor, we want to be the best possible mentors possible. And Kenzie has invested much of her career into how we ensure that that's happening and how we can prepare, train, and support mentors to do the very best job they can. So with that, I'm going to turn it over to Kenzie in her presentation, Mentoring the Mentors. Thank you.
Thank you so much. Thank you. It's great to be here today with people in person and those online. Hello. As was mentioned, my name is Kenzie Cameron. My pronouns are she, her, and hers. And I want to start out today actually with some big thank yous, because anything we do, of course, is not done alone. And all of the mentoring programs that I'm going to talk about today are through NUCATS, through our CTSA, and Dr. Mercedes Carnathan, Dr. Ravi Kalhan are the co-directors of the Center for Education and Career Development within NUCATS. Morgan Barrowman is the senior project coordinator, with whom none of this would be happening. And then Jamie Ziegler really helped us out when we launched this, which was during the pandemic and trying to figure out how to make all of this happen. And then Emily Tra and Christine Charles have left Northwestern, but they were very integral in this entire program. So to give you a sense of where I'm going today and what I'm going to talk about, I have a bit of just general introduction, and then I'm going to tell you about what NUCATS mentoring programs were, what we learned, how we've changed it, what they are now, and then give you some of the outcomes and assessment that we have. And I'll end talking about a mentor training certificate program that we've created. So I want to start kind of diving into mentoring with this quote by Steven Spielberg, that the delicate balance of mentoring someone is not creating them in your own image, but giving them the opportunity to create themselves. And I think this is so crucial for us to remember. We're not creating people to be exactly like us. If we're great mentors, what we're doing is we're mentoring people to find their passion, to find their success and their drive so that they succeed and often surpass us. And I would say that is a win in terms of mentoring. So I have a question, and it's going to be, I'm going to look at those of you here in person, but certainly if anyone online chimes in. But my question is, where did you all learn to mentor? Okay, so maybe informally from people who you thought We're mentoring you, and you started that sentence with probably. Okay. 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 Okay, great. So in the course of your job and those that you work with, you're finding that you provide mentorship? Ron? Okay. Yeah. Okay. So from mentees and feedback that they're providing, if it's successful or not. Any particular programs? Like, most of what you've talked about has been kind of on the ground.
I think national different mentoring sessions.
Okay. Okay. Great. Oh, okay. Sorry, I need to do a repeat for those online, so that national organizations sometimes have some sessions where people are able to, like at a conference, do some mentoring. And I asked this question. I want to point out that there are probably about 15, 20 people here in the audience. We heard from about 4. Nothing about the rest of you other than it's sometimes a hard question to answer. And perhaps that's why people were silent. And a lot of times I think we're not taught to mentor. It's almost assumed. It's a given. We're in academics. We were mentored. We're going to mentor others. But what I want you to think about throughout this presentation, as well as take away from it, is that great mentors are made, not born. I think a lot of times people think, oh, well, that person's a really great mentor. They were just born to be a mentor. But what I want to tell you and hopefully persuade you is that mentoring is something that can be learned, that can be taught. There are competencies, there are skills, there are things we can all do to get better at mentoring. I have up here on the screen a number of these competencies that have been put together from different organizations over time, but they include things such as aligning expectations, articulating your own mentoring philosophy and plan, maintaining effective communication, fostering well-being, cultivating ethical behavior, fostering independence, addressing equity and inclusion. And these have been identified as competencies, what we should do and do well as mentors. And these are also skills, and there are ways to learn them. So that's how we get to the NUCATS mentoring programs themselves. I want to give you a bit of brief history of kind of where some of these programs started out. And they were based upon work that was done in 2009 to 2013. And it was a national group of multiple CTSAs across the country they worked to develop mentoring best practices. And so there were 26 members from 16 different universities who got together quite a bit over time. They met for 4 years. They were very productive and wrote 13 papers about mentoring. And they came to a consensus on what some of the best mentoring practices were, which then led them to develop and test a competency-based mentoring program, which was 8 hours long. And some of their publications were related to that, the development and then the testing. And when people engaged in this competency-based mentoring program, they did see increases in some of the things they were looking for. People were more likely to align expectations, that they felt that they were more able to foster independence. And so they had results from this 8-hour session. 8 hours is a long time for people to spend. So from 2013 to 2015, Dr. Michael Fleming, who was the former director of the Center for Education and Career Development, did a condensed, sorry, I'm going to move this little people there. He created a 4-hour workshop. And what he did was he worked with all departments across Feinberg School of Medicine, all ranks, and he would get people in one department together in one room for one 4-hour session, everyone that was primarily research focused. And I point that out because I'm going to talk quite a bit more about that. So overall, they trained over 600 people across all of the departments in Feinberg School of Medicine. And that was over 2 years. So then after that, people were trained, there was this 4-hour program, what was there to do? So an annual, the program was given annually and open up to anyone who wanted to attend. And this was for 4 years. It was the same content as what had been in the original program. We learned quite a bit about this, especially in those 4 years after the intensive training had been done, when it was, asking people to come and attend a mentoring session. And some of the things we learned is that these are presented as mentor development workshops, and we had very high mentee attendance. So people were coming because they wanted to learn to be a better mentee. They wanted to learn to interact more in a more efficient way with their mentor. We also saw that there were people across ranks and tracks that were, that were attending these sessions. They were interested in mentoring across multiple contexts. The original program was really focused on research, but we had many clinician educators attending who wanted to talk more about clinical context, educational context, professional development context. And so also there were people who came to it and then said, okay, what's next? I did this 4-hour session, so where do I go from here? Because I know there's more for me to learn. But at that point, that's all that we had. So we started to think about what could we do differently. And one of the things that came to mind is that we really needed to consider the goals and boundaries of this program. So it is a mentor development workshop. The focus is on developing mentors. We kept the focus on faculty. So staff, postdocs, students are not eligible to attend these sessions. Not that some of the content might not be, applicable, but that the way that we were presenting it and the discussions we wanted to have, because there's a lot of interactivity, we wanted to have with faculty. So that brings us to what I call NUCATS Mentoring 2.0. And we had some new goals and objectives that we laid out for where do we go from here. So this was 2019. We wanted to continue to provide competency-based training for FSM faculty, again, across ranks and across all tracks. And we wanted to reach a broader faculty audience because we had a number of people who were very interested in it, but weren't hearing about it, didn't know if it was applicable to them. We wanted to expand the content areas of mentor training. So in that original 4 hours, the focus was on aligning expectations, maintaining effective communication and difficult conversations. And then there was a session on working through developing a career development plan with a mentee. But those were the 3 topics. And we wanted to go beyond those topics. We also wanted opportunities for faculty to be part of this as both attendees and presenters. And I'm going to put a little more emphasis on this because one of my goals has always been to include others in this program. Having one person constantly give information sessions month after month, maybe that person knows a lot and has a lot to give, but I think there's much greater value hearing it from multiple perspectives, from multiple people. Another goal of mine was that we could get perhaps some junior faculty paired with senior faculty presenting some of these sessions. It was then an invited presentation. It is now on your CV. And what I encourage faculty to do is let their divisions know that they did this. Let their departments know that they did this. Consider presenting it at a regional workshop. My goal is that this is something that they could then take and move forward with. And by identifying different people to do some of these sessions, the idea was these different people, they didn't own that particular content area, but they would be someone, if someone came to me and said, hey, I want someone to give my faculty a presentation about SMART goals, I would say, I want to send you to Dr. Charlotta Weaver, who did a session for general internal medicine. She did a session for NUCATS. She was asked to do sessions for multiple other departments within the institution. And that was very important to me to have those opportunities. And then we also wanted the opportunity for there to be networking and sharing of best practices among faculty who were attending these presentations. So in 2020, we launched what we called Developing and Enhancing Mentoring Relationships. This was a monthly series that typically runs from September to June. In the first year, it was October, December, and then monthly. And it was, of course, being 2020, it meant it was all Zoom and it was online. In 2021, we added the Mentor Training Certificate Program, which I'm going to talk more about closer to the end of this presentation. But the idea was, you know, people are coming to these sessions, they're engaging, they're thinking, they're doing self-reflection, they're spending time. I wanted people who attended many of these sessions to be able to walk away with something and point to it. You know, this is what I earned, this is what I gained. So I just recently learned how to create a QR code. I'm very proud of myself, by the way. So you can scan that QR code and it will take you to this webpage, which is the NUCATS webpage that tells all about the program. It gives the schedule for the upcoming year, which links you to registration. It gives you also the schedules from the previous year, and we've done recordings, and we've also put the PowerPoints up online. So that they are there, that people who might not have been able to attend can access them, and anyone can access them. So how did we do this? Well, as I mentioned, it was 2020, so of course it was on Zoom. We tried to identify a time where there weren't grand rounds from the largest departments. So we found out when grand rounds for pediatrics and for medicine were. And of course, it's hard to find a time that works for everyone. We originally put this at 7:30 to 9 a.m. One of the reasons being we wanted it to be more accessible to clinician educators. And we were hoping maybe by an earlier time frame that it might be something that they could attend before they went to clinic, or maybe there would be a little changing of clinic needed. That said, it was the pandemic. 7:30 to 9 worked really well for a number of people, but for a lot of people, it was incredibly challenging. They were trying to get their children off to school, whether actually physically off to school or off to school via Zoom in the living room. And so that time, some people loved it and some people struggled with it. Since we wanted this to be accessible to many people, last year what we did is we changed the time. We moved it slightly later, and we did a different Thursday of the month, thinking that, some people have meetings and maybe we can move things around a bit. We had planned to have 3 in-person sessions and 8 on Zoom. In the end, we only were able to have 1 in-person session because of COVID and Omicron. And so that was what we were able to do last year. So this year, we've moved it to Wednesdays. And the way that we're doing it is it's consistent of the day and the time for any given year, because I think consistency is really good for people's calendars. The idea of moving it to Wednesday is maybe there were people who had clinic or conflicts on Thursday that were never able to attend. By moving it to a different day, we might make it more accessible for them. What we've decided to do this year is it's a hybrid, but it's not hybrid like today is. It's either in person or on Zoom. And we do realize that that means that not everyone will be able to attend. So of course, we'll be, gauging how that goes and what people are thinking about it. But we do see an incredible value of being able to be in person and have conversations and share best practices and talk through best practices. We do this via Zoom in breakout groups, but we want to bring some of these in person. And so the way that we've done it this year is it's both kind of either the presenters preference or the topic. For example, we have a panel presentation slated for January about being an ally and a sponsor related to mentoring, and that's going to be on Zoom so that we can have a wider audience with NUCATS. So these are the topics that we've covered in the last 2 years and then moving ahead to this year. Those that you see in bold and with a slight green shading are ones that we've identified as being required for this mentor training certificate program. And then the others, you'll see that we have some overlap and others that we are trying to do new content each year. And we're still doing quite a bit of new content each year. One thing is it gives us the opportunity to have other people present, again, widening that net. And we're also looking at the feedback that we're getting and what people want and what types of programs they would like to have. You only see 6 noted for this year because we're still in process with the final 2 later in the spring. But you'll see that we hit many of those competencies that were identified. Aligning expectations, articulating your mentoring philosophy and plan, creating SMART goals, strategic mentoring, we have quite a bit on goals because that has been a common thread of what people have asked and have wanted. One of the sessions last year, I want to point out specifically the goal planning at different stages of one's career. That actually came from an attendee who said, I'm an associate professor and everything always seems to be focused on, how do you get from assistant to associate? And I'm not quite sure what to do now. What are my goals supposed to be? What should they look like? And so we had Dr. Ravi Kalhan and Dr. Sadia Khan do a session thinking about goals at different times and stages of your career. So some brief feedback that we've gotten and the assessment and evaluation that we've done. What we do is upon the first time someone registers for one of the sessions, we ask them to complete a baseline survey. And this baseline could be whenever. So if they don't attend a session until January, they might be doing the baseline in January. If they sign up for a session but don't attend and sign up for another session, we'll send them the baseline again. And we'll usually give about maybe a month leeway, but it's the baseline for that person entering into the program whenever it may be. The survey asks them to rate themselves, their skills on some of the mentoring competencies that I noted, and the activities and behaviors that they engage in within mentoring relationships. For each session, we ask people who attend to fill out an evaluation. It's a fairly short one, and this is shared with the presenters, and it's been incredibly helpful, particularly for those presentations that we've done multiple times, because it allows us to tailor it and change it. And then there's a final end of year survey, which is given once a year. So people might get it more than once if they're still continuing to attend and be in the program. And again, that looks at mentoring competencies, some of the behaviors, and then some program evaluation. What do people think about the topics? What are suggestions of new topics? What are some of the pearls that you might have come away with? Here, I want to show you from the baseline surveys that we received. I kind of did a quick qualitative analysis of what some of the biggest mentoring challenges that people identified themselves. And these are up here in kind of spatial organization of what people were identifying was most challenging. So time, by and large, was the greatest challenge that people identified. Setting and aligning expectations, whether they were a mentee or a mentor. Effective communication, constructive criticism, and difficult conversations. And I'd probably put an asterisk on that, difficult conversations. Assisting the mentee with goal setting, engaging the mentee, this feeling of imposter syndrome. You know, I'm a mentor? What? How do I know what to do? How did I become a mentor? Am I really good enough? Can I help someone? How on earth do I do that? There were actually a number of people who really indicated this sense of imposter syndrome. And then mentoring diverse mentees. And what I hope you see here, I realized the table I put up a few slides ago had a number of different sessions on it, but we've really tried to tailor the sessions to a lot of the needs. Time, of course, is challenging, but the way that we're approaching that is, for example, in setting and aligning expectations, we encourage people to work with their mentees and ask them to send an agenda before the meeting. So that makes the meeting more efficient. You know what you're talking about. It's not just this is what I did last week or last month, because that could be sent in an email. It's why is this person sitting in front of you for this mentoring session today? What do they need from you? What can you help them with? And so, I can't magically create time. Unfortunately, it would be fantastic if I could. But we're trying to identify kind of skills and tips and tricks that might help people use their mentoring time a bit more efficiently. So some of the outcomes that we have. I want to start with this attendance at the mentoring workshops. As I mentioned, in 2018 and 2019, we held those annual workshops and asked people to sign up and attend. We normally would get 75 to 80 people signing up and 25-ish people attending, which of course was a little challenging for planning and facilitation. But in the last 2 years, since we've switched to do these monthly sessions, I'm delighted to say that we had 99 unique participants in 2020, 2021, and another 83 unique participants, in 2021, 2022. So we're reaching a broader audience. Not everyone is coming to every session, and that's fine. The idea is we want to be presenting content that's helpful and people can come to the sessions that make sense to them. So in the past 2 years, we've reached 165 unique participants and we've had 13 unique presenters across the span of those sessions. And I'm really proud about that because obviously 165, we have a lot more people to reach, but we're definitely reaching more people than we had before. In terms of demographics, not surprisingly, about 70% of those attending are women, almost a quarter attending are men, and then some preferred not to disclose. When we looked at why are you attending? Because we asked this in the survey. Again, we focus on these are mentor development workshops, but if someone says they're a mentee, we don't not allow them to attend. We just say, we're going to be framing this a lot from the perspective of a mentor. If you're a mentee now, you'll eventually be a mentor. There's also the idea of mentoring up. Maybe you learn something that you can bring to your mentor that could help that relationship. And you may already be mentoring people. Even if you're, an assistant professor who's going for a K award, you might have students, staff, residents, fellows that you're mentoring. So even if you identify as a mentee right now, we think that what we're presenting in these sessions is valuable. In terms of by rank and track, most of the people that are coming are assistant professors, but a good proportion of associate and full professor, some instructors, and then we have some health systems clinicians. So I said we wanted to make this broader than it had been before. We don't advertise it in a large way to the health system clinicians because at that point we would be talking about thousands upon thousands upon thousands of people, and we're not sure we're quite ready for that. And some of the case studies and things that we do, we're not sure would be as relevant. But we don't exclude them. If they hear about the session and they want to come, they're welcome to join us. And actually, there are a number from hospital-based medicine and pediatrics that have attended quite a bit and have taken some of the information to try to start their own mentoring program that's more geared towards their needs. And I think that's great. I'm absolutely fine with that because they know what they need. We're happy to share the materials and the resources. In terms of track, 42% clinician educator. I point that out because these original sessions where the departments came together, that was primarily investigator and research track. And it really excluded a lot of the clinician educators. But there are a lot of clinician educators. There are more clinician educators than any other track here. And why were they not being included? So we include them. NUCATS, yes, is a research, focus, and that is why originally they weren't included. So I should say that there was a rationale for them not being included in those original 2 years of sessions, but we wanted to be able to expand it. If we only do one case study, it's probably more focused in a research realm, but we try to, if we have the opportunity, have different types of case studies, have different types of contexts in which people can apply the skills that we're talking about. So in terms of, well, how are we getting our outcome data? So in the first year, I mentioned we had 99 unique attendees, but you'll see, we had about half of them who completed the baseline, quarter of them who completed the end of year, and 16.8% who completed both. So that's a little challenging. So last year, you'll see the numbers are much better. So we had 70 out of 83 completing baseline, 42 completing end of year, and 40 completing both. We're still only at 50%, but that's still a whole lot better than the 17%. How did we do that? Mentioned this mentor training certificate program. One of the requirements for getting the certificate is you must complete the baseline and evaluation for every session you attend and an end of year survey. Wasn't born yesterday. And we do that because it's so important for us to know, we're putting material out there. Is it helping? Do people think it's making a difference? Do they want something completely different? So we're truly doing the evaluation because we want to know. And if only a handful of people fill it out, we know what a handful of people thought. But particularly if people didn't fill it out because they weren't happy, then it's really hard for us to know how might we change it? What should we be doing differently? So just a few quick outcomes that I have from the last couple of years. Again, these aren't, what I'm showing here are the baseline of everyone and the end of year of everyone. So it's not the paired. I do have that data. It shows a similar trend. So I made sure to double check that because I knew that some people might say like, well, maybe only the people that really liked it answered the final survey. But so you'll see that we had people indicated that they felt that there was an increase in engaging their mentee with articulating mentoring needs, in employing strategies to improve communication with mentees, in figuring out how to provide constructive feedback to their mentees. Some of that came from the difficult conversations section, because sometimes that constructive feedback is constructive, but it's not what the mentee wants to hear. And then coordinating effectively with my mentees' other mentors. A lot of what we talk about in many of these sessions is we don't want people to have the one guru mentor. You don't want this one person that you look at them and say, you are my everything. I mean, it's great if you have someone who's willing to give you a ton of time, but you will benefit from having other mentors as well. You will help that mentor by not asking them to do everything and anything for you, but identify, this person is my research mentor. This person is my teaching mentor. This person is helping me think about career development and career goals. They might all do the same thing. I encourage the coordination, but we strongly encourage different mentors and also thinking about mentoring in different ways. And so it's not just this traditional guru mentor, but someone who serves as a sponsor or an advocate for you. Someone who, gets a manuscript review and says, I don't have time to do it, but I know a junior faculty member who knows this area. Can I pass their name along? Or I can't give this presentation. Let me suggest someone else to you. I mean, that all ties in with mentoring. And we talk about that not just for mentees to understand, but again, this is mentor development. We want mentors to be very cognizant of thinking of that, of when we say no to something. If it's something that we think would be really beneficial, is there someone else that we could suggest to fill our place? Because that could really help a junior faculty member. We also saw increases in considering conscious and unconscious biases that individuals bring to the mentor-mentee relationship and helping mentees balance work with their personal life. I want to highlight the considering conscious and unconscious biases because, of course, this is something that as a society, we've been thinking about for many years, but we certainly have been thinking about, I would say, in much greater detail over the last few years. And it's important for us to bring that here to work as well and not just think about where are my biases in the full social session, in the full society, but am I somehow bringing biases into a mentoring relationship that perhaps I wasn't recognizing? If a mentee is not kind of meeting the timeline that we laid out, am I taking the time to find out why? Do I know if it's the timeline, was just way too, it was more than they could handle? Is it that there's something going on? Maybe they have children, maybe they're sandwich generation, they're taking care of children and they're taking care of their parents, and it's been challenging. We want people to consider that. We want people to consider if you have a mentee who's an underrepresented minority, are you coming into that with bias? Are you expecting different things from that mentee? And it's important to do that self-reflection so that you can be a better mentor. Since we did have mentees attend, and a lot of people said that they were both, we did also looked at the mentee competencies, and you see also an increase over time of each of these: the articulating mentoring needs, employing strategies to improve communication, identifying multiple mentors, and again, considering the conscious, unconscious biases. And here I just want to highlight the identifying multiple mentors, because I think this is very important for us as mentors to think about and to help our mentees with, because it helps us, it helps our research, it helps our academics, it helps in clinical areas. We shouldn't be someone's everything. And we can learn when our mentees have other mentors. We can learn a lot from the other mentors, and there can be peer mentoring that goes on in those sessions, even if you came together for a particular mentee. And then this past year, we added questions to just get a sense of, would people recommend this session? Did they perceive a value as a mentee? And did they perceive value in these sessions as a mentor? And I'm pretty happy with these results. Obviously I'd like to see them even more closely to the 5, but again, I feel pretty good that people are seeing value to these sessions. So as Dr. Ackerman mentioned, I do qualitative research. So of course I had to dig a little deeper, and we did have a number of open-ended responses. And from the open-ended responses we got last year, we then kind of looked at them, and I realized that instead of asking what was your favorite part or least favorite part, what I really wanted to know is what pearls are you taking away from it? What kind of created the biggest impression on you? So someone said, learning what I didn't know, I didn't know. Someone else noted that having a formal introduction meeting, articulating goals for mentoring, and then creating a safe space for the mentee and for the mentee to know that it was a safe space, and formalizing that within the relationship at the beginning of the relationship really helped them as a mentor. And many people also talked about going back and doing that with mentees that they perhaps had been mentoring for a while, but they realized that they had never really outlined expectations. Being more intentional about asking for and setting agendas for meetings. Self-reflection with regards to the mentee-mentor relationship. And then someone noted it made me think a lot more about race and diversity issues. We did have some conflicting responses. So some people said, and I guess I neglected to say this in the beginning, these are 90-minute sessions. That's intentional. We know people like to do things in an hour time block, but we also know when you have an hour time block, people come late and they leave early and they're not getting everything. And we also really believe that there's a huge value, not just in didactic information, but in breakout sessions, in being able to apply and being able to take that time to reflect, as the one person said. And we really feel like we need 90 minutes to do that. Some people said, nope, that was too long. Other people said it was just right. And other people said it wasn't long enough because they wanted to do more role plays and more breakouts. I noted earlier, some people said the early morning sessions were challenging. Other people loved the early morning sessions. And so again, we're kind of moving things around year by year. There's no perfect time other than I'm fairly sure no one wants to do this from 5:30 to 7 at night. So we're not trying that. And then some people saw a great benefit of being on Zoom. They said, I wouldn't have been able to attend this in person, but I could log in on Zoom. And other people noted, I really feel like I could have gotten even more out of this in person. And so, as I said, this year, we're trying to do a bit of both, and we're going to be very carefully looking at, what is the attendance like? Do we see a huge drop in attendance when we're doing it in person? Does that mean we should consider going back to Zoom? Or maybe, as I noted, we're doing some specific ones in person and others on Zoom. So I want to just end today to tell you about the Mentor Training Certificate program that we launched. And one of the reasons we did this, kind of something that was in the back of my head, is I experienced this, and I have a number of colleagues who have talked to me about this, which is, perhaps they were in research, they got a K award, they got an R, and now they were promoted to associate professor, and people are asking them to be their primary mentor. But the feedback they're getting from NIH is this person hasn't mentored before. This person doesn't have mentoring experience, which is true. You want someone with mentoring experience, but everyone has to start somewhere. And so obviously we encourage being a co-mentor on someone's K, but what I wanted to do was codify this program so that people can say, I've done the Mentor Training Certificate program, put it on their CV, put it in their bio sketch, so that even if, particularly if they were younger, they could say, I know something about mentoring. Another goal of mine is that K awardees will consider putting this in their career development plan. So maybe in years 4 and 5, or it could be earlier on, because they're probably, as I mentioned, mentoring, students, fellows, staff. And this could be a part of a already formalized part of a career development plan. So we wanted to train faculty to become effective clinical translational research mentors. And this is focused on faculty with appointments in Feinberg, faculty with appointments in other schools. We don't exclude, again, we're not kind of sending things out to them, but if they're engaged in biomedical research, they're welcome to attend and participate. And we have had some people from other schools across Northwestern. So the setup of this is that to get the mentor training certificate, you have to complete a total of 9 hours of training. And so that's 6 different sessions. 3 of them are required. We think that these are core mentoring competencies, so establishing, aligning expectations, cultural awareness to enhance mentoring across differences, and articulating your mentoring philosophy and plan. So we'll present those every year. But then we have electives. So people need to take 3 other sessions from any of the other sessions that we present. They can take more than 3. We're happy to have them do that, but they have to do at least 3. And then, as I mentioned, they have to do the evaluations. Just to give you a sense of, what has that looked like, we had 75 people originally who said they were interested in this program. Not too bad. 2/3 of those have shown up for at least 1 session. We have 17 people who have completed 6 or more sessions, and 15 who have completed the training certificate. And in case you're wondering why 17 to 15, it's because some of those people that have completed 6 or more sessions are missing a required session, and we are holding to that. But people can do this over the course of 3 years. So we know people's schedules change, life happens. We want this to be something that people can come in and out of and still get value and benefit for. About 2/3 of the participants in the training program, those who completed, are women. About 1/3 are men. In terms of mentor-mentee status, again, we have people that are saying they're both, some that are saying they're specifically mentors, and some that identified as being a mentee. Again, we have kind of across ranks, which is what we were hoping for. I'd love to see that professor row or piece of the pie grow a little bit, because I think we all, myself included, can always learn regardless of what our rank is. And you'll see that we have about half and half that are clinician or research, and then we have some investigators and some health services clinicians. I'm putting these pictures up because these are the 15 people who are the inaugural class of completing the mentor training certificate program, who completed this over the past 2 years. We did allow for retroactive credit because I didn't feel it was fair that just because the program didn't exist 2 years ago, people who attended couldn't get the certificate. So we're going back and making sure that we're awarding certificates to those individuals as well. So to wrap this all back up to what our goals and objectives with the new mentoring programs at NUCATS were, I have green check marks on all of these because I really think we have accomplished them, which probably means we need to identify new goals and stretch. But we're continuing to provide this competency-based training across ranks and tracks. We've achieved a much broader audience than we had in previous years. We've expanded the content. We've offered opportunities for people to participate as attendees and as presenters in the sessions, because there's a lot of interactivity. There's networking, there's sharing of best practices. Some of the comments that came back indicated one of the things that people appreciated was interacting with people that they never would have otherwise on campus. And then we also, this year, we expanded it a bit because the Chicago KUH Forward program that Dr. Tamara Isakova runs, she had asked if we were willing to have their mentors attend. And so we had a number of mentors attend from Loyola, from UIC, from U of C as well. A shout out to all the presenters of the past 2 years, and those who are coming up, and a thank you to the participants, because of course this wouldn't work if there weren't participants. Our next session is next week on Wednesday. So if anyone is interested, you can sign up. The QR code that I sent before will take you to that link. And we're starting with establishing and aligning expectations. And Dr. Robert Leem and I will be presenting that. And that's Wednesday from 9 to 10:30. That will be in person. So I want to just circle back to and end with, hopefully I have persuaded you that great mentors are made and not born. We can all do better, their competencies and skills. And so I'd like to invite any of you who I haven't seen in any of the sessions before to come and join us. There's always a seat open for you, or there's a Zoom screen open for you. We'd just really like you to be able to join us. So I think I did okay in terms of leaving time for questions according to, I think that's a bit slow, but I still have time on my watch. So thank you very much. And I'd love to take questions, comments, concerns, suggestions, anything. Thank you so much. I'm hoping there's at least one question, because you know how hard it is for me to like make sure I end early. So there's time for questions.
The only question was about whether or not there'll be a recording, and I should mention to everyone here that yes, there will be a recording. I will email it out to everybody who registered. So.
Kenzie, you're setting and aligning expectations, recommendations. How much do you encourage like written documents like compacts or contracts? I found that it's sort of awkward to bring that up after a first meeting, like I, agree to mentor you, but we're going to sign some paper that says what you'll do and what I'll do. But
yeah,
I found it really helpful, particularly because I've had some early mentoring experiences where you feel like you're communicating clearly and aligning expectations, but they may not be hearing what you're saying and internalizing it in the same way. So something written.
Yeah. Okay. So for those online, the question was in the aligning expectation session, how much do we encourage something written like a compact or a career development plan? And it is something that we encourage. We strongly encourage agendas for every meeting. And we show people examples of compacts, career development plans. And we note that, it does sometimes feel a little awkward. So not everyone does this. So it would be great if everyone wrote things down, but I think we'll still have a huge jump if people at least are having the conversations. And so I don't want a compact to stop someone from even having the aligning expectation conversations. So I think if you're mentoring someone who's a career development award, in some of our KL2 programs, they're used to this. One of the things that we found was people really didn't like, it used to be called an IDP, individual development plan, or career development plan. And we're now often calling it career advancement plan, because we had people who were maybe 5-7 years in who just they had a negative reaction to a career development plan. They're like, that's what I did when I first came here. I'm further on now. And so I don't want people not to have conversations because they're worried about the signature, but I do think it's very beneficial. And particularly if you have a lot of mentees, that could be something, and that shows them you're thinking about, this is what I agree to do for you, but these are the expectations I have. The other thing that we note is if you have that compact or you've had that discussion, it shouldn't be a once and done. You need to revisit it because expectations change, experiences change, contexts change. And so it's not enough to just have a first meeting and say, okay, we're aligned, because certainly many of us have probably had the experience of, a year and a half later, you've kind of gone off the tracks. So we want people to continue to have those. Yeah.
We have a number of questions online, but I know that Jeff also has a question, so I don't want to hog, but one of the questions is the program open to staff and faculty from other institutions?
So faculty, maybe. It is not open to staff now, and that was an intentional reason, because I do think that some of the competencies are similar, but the way that you're engaging in mentoring is different. And I think that should be done by staff and staff mentoring, because they're the ones who know what some of that is. In terms of faculty for other institutions, I'm happy to have people contact me. We did open it up to the other institutions through the KUH Forward, particularly when it's online. That's a very easy thing to do. And so I'd be happy for people to reach out.
So I'll pick up rails. I'd ask you to comment on the idea that you're seeing the people who are engaged, motivated, showing up for mentoring activities. There might be even more concern for people who have no idea they have a problem, mentees that don't know they have a mentor or have a dysfunctional mentor-mentee relationship. Like, how do we even begin to operate in those areas?
Yeah. And thank you for that question. So the question was, the people who are showing up are engaged, are motivated. What about those who perhaps need some training, but think that they're great and they don't need to come, or mentees who don't even realize that, there could be, their mentoring relationship could be better. So in terms of how we're addressing that, I mean, honestly, I'm hoping that the mentor training certificate program, the fact that you get something for this, although, more senior faculty might not need that, but that could be a motivation for someone. That's also why we allow mentees to attend, because I think there can be a lot of mentoring up. So if a mentee has kind of had meetings with their mentors and they're just going hither and yon, the mentee could say, I'm going to give you an agenda. And I'm going to, the first part's just going to be what you need to read to catch up. And then these are the things I want to talk about. So there could be ways of doing that as well. The other way is spreading the word. So, thank you all for being here, and I encourage you to spread the word to others as well. I'd love to see you there in any of these sessions. And I think that we can do a lot with our peers. So for those who are attending the mentoring sessions, to be able to go back to their divisions and their departments and say, I got some value out of this, even though I've been mentoring for many years. I mean, I attend every single one of these sessions. So I have gone to 18 sessions in the last 2 years, and I learned something every single time. I mean, I'm lucky because I get to attend all of these sessions, but there's always something we can learn, and there's always something we can do better. So in terms of direct, how are we doing that? We're sending out like email splashes to all of the NUCATS, but I really think a lot of it is going to need to be some of the personal and interpersonal, hey, let's do this, or department chairs could perhaps suggest strongly that some of their faculty could consider attending. So, and I'd love other thoughts if you have them too.
Okay, so what was the most surprising finding over the last 2 years of data?
Oh, what a great question. The most surprising finding over the last 2 years of data. I actually think in some ways, it was a little surprising about just how many people we did reach, because we had spent years, doing sessions for 20, 25 people. And so it was what I hoped, but I didn't expect it. So I guess that was a little surprising. I would say the other thing is I really saw some people that attended multiple times kind of starting to develop a cohort. And that I think is an unintentional benefit from this, because there might be someone in radiology who is in a breakout group with someone from hospital medicine, and they had a conversation and it really clicked, and now they're interacting, or now they see them on campus. And so I think that also was a, perhaps it shouldn't have been as surprising, but maybe a surprising finding that even on Zoom, there could be this community that people felt.
We have one last question and 1 minute. So don't know if this is a fast one. Do you discuss coaching versus mentoring and the role of each in your program?
That is a great question. So we've done some of that in the Articulating Your Mentoring Philosophy and Plan. It's actually led by Adam Goodman, who leads the Center for Leadership on the Evanston campus, who is a coach who does a lot of coaching programs on campus. So we talk a bit about that. We talk about coaching as a part of mentoring and a different style when we're talking about the aligning expectations. And I said there's still 2 sessions that we're finalizing this year. And I think one of those 2 is probably going to be a bit more of a coaching focus. So I think that was within the minute. All right. Well, thank you all for coming. And I'd love feedback, suggestions, and I appreciate you being here.